Welcome to IHA Live here in December. I'm so lucky to have Dr. Amanda Marsh with us tonight. She's actually live broadcasting from her truck right outside her daughter's Nutcracker recital. So she's made it a huge effort to be with us tonight. Dr. Amanda Marsh is, of course, a doctor of veterinary medicine, also a certified veterinary acupuncturist. She's the owner and operator of Prairie Summit Veterinary Services in Cody, Wyoming. She studied veterinary medicine at Colorado State University. Dr. Marsh has been in private practice for 8 years and is tailoring her practice to equine medicine, lameness, neonatology, and reproduction. She's also a certified veterinary acupuncturist. You can go ahead and visit her website if you want at prairiesummitvet.com. So I actually asked Dr. Marsh if she would come on the program tonight because I have really enjoyed the relationship I have had with her personally as one of the primary veterinarians that I use. I feel like she's a huge resource, not just for what is generally accepted, of course, in the veterinary world, but she does come from a unique perspective in the way that she does try to look for different alternative and holistic solutions. And so I think this is a fabulous opportunity tonight. If you are interested in knowing if there are some primary health concerns that you would like to know, and possibly Dr. Mars has what would be typically done, possibly a more holistic view, and then most importantly, her own recommendation based on that experience. So, Dr. Marsh, thank you so much for coming here tonight.
Oh, thank you for having me, especially in my truck.
Yeah, exactly. This is fabulous. And what I'd like to do is actually go through and talk about some primary issues that I know that all of us usually have, which would be generally worming and vaccinations. And then we might touch a little bit on equine metabolic syndrome and the difference between that and some other well known equine diseases that happen later in life. And then, of course, if you do have specific questions for Dr. Marsh, please enter them in the chat. And we will have a question and answer session at the end to make sure that we try to answer those questions for you. But what I'd like to do now is go ahead and maybe start with vaccinations. Is that okay, Dr. Marsh?
Yeah, that sounds fantastic.
Okay, great. So what Dr. Marsh is hopefully going to do tonight for us is go through what would be a typical, and by the way, just so you know, she was one of the feature articles in our second edition of the IHA journal. So she does have information about vaccination and worming in that, but I'm hoping that she can elaborate on that tonight with us. So Dr. Marsh, why don't you go ahead and take it away?
Okay, sounds good. So it's definitely a different approach tonight. I'm usually good at interacting with people and using my hands a lot, so I apologize if I do this. But we'll kind of go ahead and start talking about vaccinations. I just got back from our annual convention in Denver this past week, actually, and there were some kind of new topics, and I mean, obviously, a lot to go through at that convention. But some of the newer things that are coming out, especially in regards to immunization, because I feel like as a society, we want to approach things a little bit differently than we used to, especially trying to maybe tailor down to the more specific stuff and try to avoid anti-vaccine things, but also maybe vaccinating too much. So kind of finding a happy medium that exists somewhere in there. We find the same thing in our small animal counterparts as well. Maybe they've done a little bit better job than we as horse practitioners have done so far, as trying to find how good our vaccine titers are for different vaccines, how long those last, because that's really the question: is how good are our vaccines and how frequently should we be vaccinating things. And for many, many years, our approach in horses was solely to vaccinate with multivalent vaccines, so vaccines that have multiple different viruses in them or multiple bacteria, um, and doing it multiple times a year. And I'm definitely, I definitely believe in the power of vaccination. I believe that it has probably saved our society in many ways. But I don't know that that's necessarily the right approach either, is to just vaccinate multiple times a year against things that we are potentially protected against. Um, so I'm going to bring up the AEP's conventions, basically big status on immunization, and we're going to kind of go through this PowerPoint and talk about, where AEP has some wonderful ideas, but then also maybe some things that maybe, especially from a practitioner's approach, maybe people can take a little bit differently. So,
Thank you so
okay.
much. We appreciate both views tremendously.
Now let's see if I can get this done appropriately. Um, so yeah, this is generally the association's approach, and kind of big consensus statement on immunization. Um, Let me make sure I can go through this correctly. Oh, here we go. Hold on. So listed on this slide is going to be your main vaccines. I mean, there's also a bunch more out there, but these are going to be your top um, viruses or bacterial vaccines that exist. The core vaccines, um, by AEP standard, is going to be your tetanus, your West Nile virus, your sleeping sickness vaccines, and your rabies. And that's what's considered core for the AEP. And basically, we rate core based on what every horse can and should be immunized against, because basically all of those diseases are present in the environment or by wildlife that can be transmitted. And so every horse is at potential risk for them. Your other viruses and bacterial infections, such as rhinopneumonitis or strangles, Potomac horse fever, and influenza, those are not considered core, even though in a lot of our, especially our equine athletes, they're going to be more higher at risk for exposure. So we kind of use those as you vaccinate against them if it warrants it that they are going to have more potential for exposure, such as travel or different parts of the country. So um, this, I think, is the most important thing when it comes to vaccination that people need to understand, is that no vaccine is 100%. Um, it it depends on so much. Your average healthy middle-aged horse is going to have your best vaccine titers. So basically, the best response to immunization that there is. You go to your younger horses; they tend to be a little bit more naive to viruses, and they don't have that lifelong immunity that we develop over time. So our younger horses and then our older horses, whose immune system is just not what it used to be, those are those horses that are going to be more at risk for disease, and also more likely that vaccine may not be 100% effective.
Mhm.
Um, in horses, our vaccinations primarily are injectable. There is also um, intranasal vaccines, and intranasal vaccines were a nice development because they kind of, versus injectable vaccines, they injectable vaccines basically stimulate the whole body's immune system, whereas intranasal vaccines generally they do stimulate partly a whole body response, but what they do is they stimulate something called mucosal immunity, which is basically, if we are going to get the flu, we are probably going to inhale it. And so the best place to protect ourselves from influenza is making sure that the cells within our nose and our mouth have immunity against influenza, and which is kind of nice because there is some thought that intranasal vaccines that you have less systemic you have to have less systemic adjuvant, so the things that part of vaccines that maybe people don't like as much, and a more localized effect versus affecting the entire horse. So horses that tend to get vaccine reactions, these intranasal vaccines can actually be pretty good. I've never actually had any issue with them. So
Mhm.
Um, this basically talks about the way we generally approach vaccination is to start with primary vaccine, and then usually a booster if a horse has never been vaccinated in the past. Younger horses, we recommend 3 vaccines, so a primary and 2 boosters. In adults, there's some thought that maybe you only have to give them 1 booster, but sometimes the jury's still out on whether that is true or not. So, uh, this
Have
kind of talks.
Oh, I'm
Oh,
so
sorry, go ahead. No.
just to interject on your question there, the jury's still out, so there have been studies at which there's been antibodies present after 1 or 2 boosters.
Yes.
It's not necessarily,
Yeah.
necessary to do more than that.
Yes, ma'am. That's exactly it. And I think it all depends on the individual immune response. There are definitely, I think your average probably best response is probably somewhere around a primary and then a 1 follow-up vaccine. There's always outliers. There's some horses that after 1 vaccine they have such a good immune system that they respond very quickly and with a heavy titer, and then there's some that even after 3 vaccines, they are still not as great. So, in general, most of my horses, and sometimes it's convenience too, because oftentimes your young horses, I mean, they're going to come in around 4 to 6 months of age, get their first vaccine. I maybe get them back a second time in a month, but most of the time, those horses I don't see them again for a year, and I've had multiple barns that I do that have large, cutting horses and rodeo horses that are going to be out there and been exposed to influenza and other diseases. And even after 1 booster vaccine, those horses do just fine.
Mhm,
So 3 is a little hard to push the average person to come do. And I'm just not quite convinced that you necessarily need to do that 3rd booster. Um, Especially from some of our research in dogs. Horses don't titer as well as dogs and cats do from our vaccines, and whether that's because that's the horse's individual immune system or if it's because our vaccines are a little bit different in formulation than dogs and cats. But yeah, I think that those horses with just 1 booster do tend to do just fine.
mhm.
So,
We do have some vaccine questions coming up, but I'm going to just wait until you come through this
yeah,
presentation to ask those questions at the end. So if you
yeah.
are typing questions, please go ahead and continue. And I promise after she finishes the vaccine presentation, I will get to your questions.
One thing to say too is, especially um, these two, tetanus and rabies, in my experience, these are the two that rabies is probably one of the best vaccines that was ever developed. In all honesty, in general, it's a kill. I mean, it is a killed vaccine, and really the titers on rabies are really, really good. Um, they've titered some horses out 3 and 5 years and had adequate coverage. I think in the human medicine, I got my rabies vaccinations when I was in veterinary school, which was almost 9 years ago. I checked my titers about 6 months ago, and I still have absolutely huge titers. So rabies is absolutely one of those vaccines that, especially if you're going to be conservative and you try to, minimize the amount of vaccine that you're putting in your horse. I think rabies, like once every 3 years. Some of this, the big thing is that the vaccine companies will only stand behind a vaccine to where they can guarantee that every horse is going to be protected. So most of your horse vaccines, where a pharmaceutical company will stand behind them, is only somewhere between 6 and 12 months. So if your horse does develop that disease outside that window, they kind of won't take handle for that. And
Well, it
but
surprises me at all that they would take responsibility even with the vaccine. I thought that there was a big label on it that said just because your horse has been vaccinated doesn't mean they won't get the disease. I thought they
Yeah.
were like completely covering themselves in that respect. But you said up 6 to
Yeah.
12 months, they do take some sort of responsibility?
They will, especially I guess this is probably one thing that they do is that especially if your vaccine is administered by a veterinarian, and that's kind of the caveat they give you is, if it's administered by a veterinarian, anytime that I've actually had an issue, I've had a couple horses develop flu after being, after getting the flu vaccine. And basically what I do if I have those kind of cases is I call up the vaccine company and I say, hey, we vaccinated this horse. It was 3 months ago. Um, you know, eh, how do you guys feel about this? Usually, a lot of those companies, while they do get sometimes a bad rap, oftentimes when I speak with my sales reps or the doctors within the company, oftentimes they really love that feedback because it helps them develop whether their vaccine needs to be changed because vaccines do need to be changed on a relatively fast rate, especially your influenza vaccines. But at the same time, I have had actually a couple instances where vaccine companies have stepped up and said, "Hey, we'll provide testing materials so you can test them, and we will also provide antibiotics." Or so sometimes they will step up and try to help out as far as that is, or maybe send in an intranasal vaccine to help prevent infection of the remainder of the herd. So it's kind of amazing what they will do. They, and of course they definitely do that commercial like blanket theory of, you don't come looking for us. But at the same time, um, in general, they do pretty good. I've had some really good success talking to them. So I think that it's always something to, if you do have horses that get infections or get disease after being vaccinated, it's definitely something to tell your veterinarian so that they can approach the company, and whether it helps them develop a better vaccine later on, or if they can step up and maybe help out with that infection, that is always a good thing.
Yeah,
So
no, that's actually amazing news. I never expected you to say anything like that, and it's actually very encouraging that they do want feedback on their product, and they willing to go out there and actually help if there
yeah,
has been a case like that. So thank you so much for that perspective.
yeah. Um, the other vaccine, and this is one where so they talk about tetanus. I think if there was any vaccine out there that we do, our domestic horse is extremely susceptible to tetanus,
Mm.
and in humans, our tetanus titers go out for quite a ways, and I can't remember if I get poked with a nail, how when I go to the emergency room, how many years it is. I think it's like 7 or 8 that they will be okay with tetanus vaccines. In reality, horses are, and because they have such a propensity to, you know, step on a nail or, hit themselves on barbed wire, the things that do oftentimes carry um, rust and soil material. I believe that tetanus is one where I only feel comfortable at that year mark as having protection. So you will see if there is a vaccine that, like if I have a horse that comes in and has a history of getting cut by something or shoving a nail up in their hoof, the one thing that I will probably do is ask about their tetanus status, and if nobody knows, I will repeat that vaccine because it is devastating. And I've had a few tetanus
Mhm.
cases, and they just don't recover. And so I think that that's probably the one vaccine to take very seriously as far as um, repeatedly using. Um, but the
That's
others
something that's
definitely tighter better.
I'm sorry to interrupt you. Is that something that's
Nope.
effective? Like, let's say my horse did go step on the nail, and I don't know if my horse's,
Yeah.
tetanus, where is he at with it? Is that effective that I can go immediately give him the tetanus shot and it will help at all at that
Yes.
point? Okay.
Yes, ma'am. Because tetanus is technically a bacterial vaccine, and what you're actually vaccinating against is the toxin that is produced by the bacteria. And where it happens is that your horse gets a puncture wound or something, and that bacteria sits in there and replicates and then produces toxin. And the tetanus vaccine is actually fairly rapid, and so there's some pretty good proof, and it was really back probably in the early 90s, late 80s, of how effective tetanus toxoid vaccine was, because before that horses were dying pretty rapidly of just straight up puncture wounds.
Wow.
Yeah, so it is, yeah, if you get a puncture wound, especially by something that you can't consider clean, that's probably the one best thing that you can do.
Okay.
So,
Thank
yeah.
you.
Let's see. I'm gonna keep skipping through here. And some of these we're going to glance over because they're not quite exactly what we were talking about. Here's that core vaccine list. Rabies sometimes can be a very hard push, but I think it's a great vaccine, and luckily, I think it's one that we can probably do, once every 3 to 4 years, and really feel like we've got some great coverage. West Nile vaccine. Some people got really scared of it. Because of just anecdotal things of the vaccine causing disease. In theory, none of those were actually correct. But some people have started getting a little lax on West Nile vaccination, and the company itself has tested it out there at about 18 months and had a pretty decent titer in their research populations. Um, so I think that the titer on that, but like I said, there's very little evidence of what titers are in horses. But I think your West Nile titer is probably out there in that year and a half to 2 years. Um, and that's probably why, even though people are not vaccinating as much against it, that we still are having a fairly safe population. But it wouldn't surprise me if here in the next couple of years we see more West Nile cases than we have in the past.
There is a question about West Nile. Would you like to address that at this point?
Yeah, yeah,
Um,
absolutely.
Lisa, are you able to unmute yourself? Or since there's not too many people here, you can certainly ask your question.
Sure.
Yeah.
So, this is the
Hi,
Lisa
Mark.
that
This is
you
Lisa.
know, and
How are you?
Good. How are you, dear?
Good. I had a question on the West Nile virus vaccine. Um, Down here in Texas, they tend to do it twice a year, and I'm wondering, is that really needed? I know you just said the titers go out 18 months. I do worry about over vaccination and sensitivity to vaccines. Um, and it does get colder here in the winter enough that there's not many mosquitoes most of the winter.
Yep.
So, what are your thoughts on that one being done twice a year in an environment like Texas versus, say, Wyoming, where I only used to have to do it once a year?
Absolutely. Um, I do kind of tend to stick with, and my vaccines are by Boehringer Ingelheim, and realistically, they label it as safe out to a year. And I really do kind of probably prescribe to that. I mean, I know it's different in areas where we do have, the way disease works is if you are in a place where there is more disease, then maybe the potential for needing more vaccine is true. But um, realistically, I don't know that they have shown that there is a good reason to be vaccinating twice a year for West Nile, because the vaccine has gotten so much better than, say, it was like 95, 98 when West Nile was really prevalent. Um, and so I even in a place like Texas, I think your West Nile vaccine, probably at least for a year, I would feel pretty darn comfortable. But and the Texas veterinarians, they might be maybe a little bit more apt to say that they have more exposure, which is probably true. But I don't know. The new West Nile vaccines are pretty darn efficient. So I guess I would probably still stick to the once a year.
Thank you.
Yeah, absolutely.
and
Uh,
is there a way that Lisa could ask her veterinarian, like you said, the specific brand of vaccine that you used was they were
Absolutely.
recommending a year in between? maybe
Yeah.
Lisa could ask her vet which one, which brand she's using, and it would say on there too, just to be.
Absolutely.
Is the West
Absolutely.
Nile also one that can be titered?
I was looking at the most recent list that you can titer through IDEX, which is a lab that we send off to, and it is not on there. And honestly, I'd have to go through and look at some of the universities that are running titers. A lot of them are used only in the like the research stance. That's probably why it's not really become super commercial to do titers on horses, and that's why our information is pretty poor. Um, but honestly, I'd be happy to look and see if I could find any of those kind of things. But at least to my knowledge, I haven't seen any yet that are commercially available. So
Thank
yeah.
you so much.
Absolutely. And absolutely. I truly believe that asking your veterinarian what vaccines they are using, I think is a very big important part for a client. Because even if it's as simple as like, different vaccines have different efficacy rates, and they also have different levels of reactions and things like that. And the vaccine companies are always trying to minimize those things, because obviously, if you have more vaccine reactions, you're going to lose patients and lose clients because they don't want to use those vaccines anymore. So,
Mhm.
and usually your veterinarian should very, very much be able to defend why they have chosen to go through that company, and reasons why they like those vaccines. I use BI or Boehringer because I've had very little to no vaccine reactions, as opposed to some other companies. So it's just kind of my choice, and yeah, so that's kind of the direction I go.
Thank you. Thank you so much.
Absolutely. Let's see. Tetanus, we kind of talked about. These are more kind of overviews of what diseases are, but we already kind of talked about why you would use tetanus. It is kind of a really sad disease. I was going to skip through these PowerPoint slides too. You can go on the AAP website if you want to read more about particular um, viruses and why we recommend them. Um, uh, so yeah, so I'm kind of skipping through these. Rabies, obviously, in Wyoming we do have rabies. In basically every state um, we have certain animals that have rabies. I was in Colorado when we had the big outbreak of rabies in horses, and was actually a part of the team that did the first necropsy and the first rabid horse that came through, which is why I got vaccinated fairly early in my vet school career.
Wow.
Um,
Yeah.
and so obviously it's devastating when it happens because there is no cure. So I think that's probably the benefit of rabies vaccination.
Actually, if you don't mind, there is a question about rabies.
Yeah,
Would you mind
yeah.
answering? Sue, are you able to unmute yourself?
Yep, I'm here.
Okay, if you would like to ask your question, go ahead.
Yeah, well, it's sounding like probably a 3-year protocol for rabies vaccine is what I'm looking at. I guess I was always under the impression it should be done yearly. We're in Western Colorado, and I have a young horse who is 2, who I have not vaccinated yet, and wondering. This is prompting me to say I completely spaced that off this fall. I need to get him vaccinated. So, what is the booster? How many weeks
Yeah.
between the booster?
Even in horses, um, even like in our small animal counterparts, we do consider that vaccine good. For like one shot, and then to come back around the next year and give them a second vaccine.
And then
That
wait 3 years?
Yes, and
Okay, perfect.
yep, and that's what I do in my colts. Is I give them one at 6 months, is when I give my vaccine to my foals, and then I wait for specifically rabies, and then I wait a year and give them a second one. And like I said, rabies is not, I mean, we don't have a lot of good titer research, but being around the rabies vaccine enough, and because of the level of exposure is fairly low, I think that 3 years is probably a very good
Safe.
extrapolation. Yes, ma'am.
Okay.
So yeah,
Okay. Thank you so much. I appreciate that.
absolutely. Um, Kind of going quickly into those vaccines that maybe aren't quite as good or that change a lot. You hear a bunch of it about the influenza vaccine in people. There is some Dr. Gabby Landau down at CSU did a lot of research into the flu vaccine in horses, and kind of helped a little bit with the human flu vaccine. Horse flu does not mutate as fast as human flu, but it's not far off. And so influenza, that vaccine changes really quite a bit, even though it may be under the same name. Oftentimes the serotypes that are within that vaccine change from year to year. We always figure that we're probably one serotype behind, and that's what they also say in the human field. So there are a lot of people, especially with horses that are traveling a lot, that are vaccinating these horses every 6 months. Maybe sometimes they will do a killed vaccine in the spring and then come around in the fall when horses are spending a lot more time in closed quarters and closed air spaces and go through and do intranasal vaccine. I can't point any bad fingers about this, mostly because I have seen that flu vaccine fail at the 6 month mark. And so some of my horses, especially my cutters who go in and they spend a lot of time showing in the winter time in those confined spaces with horses really close together. I think that influenza, because it can be very devastating when they get it, is one of those vaccines that you may do more frequently than you like, especially if you're going to have your horses out and about, and especially in your young horses, your 2 and 3 year olds that are going to end up in showing environments. I think influenza is probably one that you probably need to vaccinate for a little bit more frequently.
If
Um,
if you don't mind, I would like to ask a question about the influenza because,
yeah,
it is associated with horses and traveling.
yeah,
I wonder, of course, giving the vaccine can cause the horse, obviously it depresses their immune system for a little while
yeah,
after giving it. So, what would be the ideal time frame before the show uh,
yeah,
to give the vaccine? And then the other situation is, well, if I have a healthy horse, and he has been, I know you said it can be up to every 6 months, but
yeah.
just like in people, um, I personally, I don't take the flu vaccine.
Uh-huh.
I don't
Yeah.
know what you do personally.
Usually I forget about it and I don't ever get it. So, in all honesty, yeah. I think that realistically, you want any vaccine and even the intranasal vaccines to really be on board about at least 2 weeks prior to any potential exposure. I think that if you're especially in a traveling scenario, if you're going to vaccinate them, you have to give them that. And then you also, just like you said, um, I I really, really tell my clients, don't vaccinate your horse and then go throw them on the trailer and go to the show. You don't get any protection out of it. I mean, you just wasted your money. And B, the horse does have a profound immune response. I mean, they oftentimes, some of the research models actually show a pretty good, very transient but spike in their core body temperature, and it kind of does a little bit of a roller coaster for a few days. And there's shipping fever, is something that is just, I mean, even without vaccine is horses at risk. And so yeah, I never vaccinate within 2 weeks of leaving for some sort of show or being in a trailer for any prolonged period of time. You're just asking yourself for a big problem.
Yeah.
So absolutely, give yourself a lot of leeway, and especially young horses, because they're going to have a profound immune response, and oftentimes those guys do get pretty lethargic for a few days.
Mhm.
Um, so yeah, I would definitely stay away from vaccinating right prior to any kind of travel.
Okay, thank you very much.
Yeah. Um, Let's see, influenza. Rhino tends to be the big kind of scary disease that's out there, mostly because you have multiple serovars or types of rhino that exist out there. Herpes virus 1, 2, 3, and 4. And they all carry different kinds of disease. Obviously, respiratory is what the main vaccine prevents against, and the the other rhino, other herpes virus that's out there, obviously causes the neurologic disease, which is in this part of the PowerPoint. And the big thing to realize about this is there is no vaccine that prevents against neurologic herpes. A lot of people come to me and they say, "Oh, I heard there was a neurologic herpes outbreak in Utah, and I'm headed that way, and I need to get vaccinated." Well, it's not going to do a darn thing. It is a mutation. So yeah. So rhino is one of those things. It is a reactive vaccine. I think you have to be really careful with it. So it's definitely only one of exposure, so only one that you are going to use either if you have pregnant mares, or breeding animals, or if you're going to be traveling extensively. So
Mhm. We actually, when I was teaching in Rapid City, South Dakota, at the equine school there was an outbreak of the rhinoencephalitis,
oh yeah,
and it was a heated barn. There was 80 horses in the barn, and many young horses. They would do a colt starting class, and all of those horses would hopefully be vaccinated 2 weeks prior to
yep,
arriving at the barn, and then um, it seemed to affect mostly those young horses that hadn't traveled, mostly 3-year-olds and 4-year-olds. My horse was also in the barn. It was pretty scary. There were horses, a couple of them had to be put down, and a couple of them recovered from it. But obviously, we were on lockdown, and none of the
yeah,
horses could leave. Um, but it's interesting that you say, you talked about that there is no vaccination, and I was always wondering, well, maybe those horses didn't get vaccinated early enough, and therefore they weren't, they couldn't protect themselves. But
yep,
apparently there was no chance for them at all, actually, and
yep,
maybe their immune system, just because they had never been exposed outside of, they probably lived at their own farm until that
yeah,
point. Their immune system was fairly depressed anyway, or not very
yeah.
exercised. Uh,
Absolutely, and I think that is it. And then a lot of these horses, we know that the herpes virus, is kind of likes to do mutations and things of that nature. So, yeah, it's not very predictable. At least as of yet, we don't have any kind of protection. So,
I
um,
don't know if you've I just had a question for you too. I don't know if you'd heard of it, but actually something um, that we found at that school. I consulted a veterinarian to see how could we stop this. Oh no, now the name is escaping me. I'll come back to it.
you're
But it
fine.
was actually an amino acid that we could give that would actually block the receptors of.
Lysine was
Yes,
it? Yep,
yes.
absolutely.
And
Yep,
so I just keep that around. I just got it at a feed store. I keep it around in my tack room. If I see a booger, I just give my horses that, and it seems to help quite a bit. I don't know if you've
ab-
had any experience with that.
Yes, absolutely. I have quite a few of my horses that I do keep on lysine even during the show season. And when we had this most recent outbreak this year with some vesicular stomatitis, because obviously we don't have a vaccine against that. Um, there's only proof that it works in the respiratory viruses, and most particularly herpes virus, but even in cats, we have some pretty good documentation of using lysine inhibits viral replication. So, um, Yeah, basically anytime I have horses that are showing, I oftentimes use lysine, and like you said, anytime you kind of see any kind of respiratory, and horses get colds. I mean, we've all seen them just kind of get little respiratory things that we know aren't influenza and we know aren't something else. Lysine really does a really nice job. Um, the other product that's out there is one called Equistim. And it's an injectable, and it's basically an immune modulator. It doesn't come without some risk, but especially in the face of outbreaks, I've used it. And basically, the thought is it helps horses that have already been vaccinated and already had plenty of other things to protect them. It does help them mount an even more profound immune response to those things. So Equistim is something that I use, especially when I have an outbreak situation.
And that's
So,
only available through a veterinarian, is that correct?
yeah, and
Okay.
it's one of those products that you definitely like. You only want your veterinarian to administer it, mostly because if it doesn't get administered properly, you can have some serious effects. So
Okay. Well,
yeah,
it is good to know that there might be some help available right away if your horse does get a severe cold.
absolutely, yeah, absolutely. This last one we'll talk about before we move on to deworming. Strangles, obviously, kind of one of the more scarier diseases because it can, like, sometimes it goes just fine. Oh, I'll go back. And sometimes when those horses get it, they get really sick. The biggest issue for me is this vaccine's not great. Bacterial vaccines, we know, never carry high titers comparatively. And so, my biggest thing, so there's an injectable and there's an intranasal. I tend to use the injectable only because um, the intranasal vaccine, because it's or bacterial particles, basically, if you take that intranasal vaccine and any way contaminate your hands, a needle, anything like that, and you stick it in the neck of a horse, you will cause massive abscesses. And so it is a vaccine that it has a lot of secondary side effects. Even the intermuscular one, I do get horses that get extremely sore from it. So I will tell you, I only vaccinate for strangles almost primarily in my rodeo horses because they tend to be a population of horses that spend a lot more time in close quarters. But it is definitely not a part of my core vaccines, and I'm very careful with it. And it's yeah, so that's kind of my spiel on strangles. A lot of I was worked down at this 4-6s, and oftentimes some of those big ranches they will sometimes let strangles just kind of go through their young horses and let them become affected because the thought process is maybe they won't get affected again in their lifetime if they naturally get the infection. Of course, there can be horses that get what we call bastard strangles, which is um, basically abscesses through their entire body, and so there is some risk about horses getting it, but the vaccine is definitely one to be very careful with, for sure.
Oh.
So
Well, so I have another question. Ada, are you able to unmute yourself? And this is about vaccines in general. Is that pretty much what you wanted to talk about in general for vaccines?
yes, ma'am.
Okay, great. And we might,
Yeah.
honestly, Dr. Marsh, I know we wanted to many different topics tonight, and it's always hard to know how much do we need to put on that list, and it really depends on the interaction of the people here tonight. But
Yeah.
I think that you do have some more questions about vaccines, and if we don't get to the parasites, we might just have to schedule you for another talk.
That that is absolutely fine. Yeah, I'm more than happy to answer some questions about it.
Sure. So, Ada, are you able to unmute yourself and tell your
Yes,
story?
the internet should be good. Can you hear me okay?
Yep,
Perfect.
absolutely.
Oh, cool. So last spring I got my horse vaccinated with the 5-way, and he was at the same time he was sedated from for teeth.
Yes.
And Kai was 7, and my 23-year-old pony was also got the same, the sedation and the teeth and the vaccine. And she was running around and she was feeling great. And Kai did not wake up from the sedation for about 3 to 4 hours. He remained drowsy after the vet already left. And then he refused to get up for about 3 days and refused to eat and didn't eat anything, barely drinking water with like molasses in it on the 4th day. And then when he stood up, he was kind of foundery and his feet were hot and sore and he was walking around a bit. And I called the vet and say, hey, Kai wasn't feeling well after. And the vet absolutely exploded at me, cursed at me, said that how I can't believe it's so biased and horrible of you to blame the vaccine. And I said, hey, just wasn't blaming the vaccine. But now I've been pretty shy to vaccinate again. So this spring I did not, and I'm scared to do it again because he was really sick.
Yeah, I absolutely don't blame you. And I've knock on wood, I've not had that profound of a vaccine issue, but they are out there, and it's it's kind of the same thing with human medicine is that I have 2 daughters, and obviously, like, I vaccinated them and I did all of those things. I do know, though, that there are children that have horrible reactions to vaccines, and because you do end up being very scared, and in your boat, I would absolutely be a this may sound a little biased, but you need to find yourself a veterinarian that's going to stand by you a little bit, because
Lie down.
yeah, because I'm a horse person too. There's no reason that I want to potentially put a vaccine in my horse that's going to have something happen like you did, and so you need that kind of support system from your veterinarian, and also that way if say it comes up that I would be with you. I don't know that I would vaccinate that horse again. I'd do things like Farah was saying, like with the lysine, things like that, maybe lower exposure, don't take them to things that might have more issues. But there's other things, like if I have a horse that say gets a little feverish, or maybe I've had a few develop maybe some local swelling, or even occasionally some small hives. If that horse is going to have exposure and I know that I want them to be protected, the next time I vaccinate them, oftentimes I will pre-medicate them with something like Banamine, or Butelus, or something that is going to help mediate that response to a more legitimate response. Because whenever the body does those things like you described, it's because they are overreacting. That's not a normal immune response to do that. So basically, there are things you can do to mediate that. In your case, I'm with you. I wouldn't. I'd be hard pressed to vaccinate your horse again.
It took me 2 months to get him back to feeling better again, and it was
Absolutely.
awful. And
Yes.
nobody really, other than Farah, nobody was all the local vets here said no way the vaccine caused that, and you're just making stuff up. And I didn't have anybody, and yeah, it was ridiculous.
Well, and the thing is it's and it's what it is it's almost like people who have lupus, or people who have rheumatoid arthritis. Those are all exacerbations of the immune system, and we have it in horses. I've seen what we call immune mediated myositis. So they will have a vaccine, something happens to stimulate that immune system. So it's not necessarily the vaccine's fault, but what it is it's the body's own over exuberant response. So it's the vaccine's fault because it was given, and that's what made the immune system go crazy. um, but I think it's especially if you can't quite be a veterinarian that says things happen, and you just basically you have to work to make those things better and have a better approach to them. So it was obviously the vaccine that did it, in addition to your horse's immune system. So it just an unfortunate series of events.
Would splitting it up help it? Do you think the 5-way
I
could have made it a lot worse versus
I I would absolutely say that. I think that there is some really good research that multivalent vaccines, like we do it in cattle, we put like 7 and 8 vaccines in there, and cattle do okay with it. I personally, I don't have a vaccine in my practice that has more than 4, and even 4 is kind of pushing it, but it's the more inert vaccines like the tetanus and West Nile and EWT that are together. Um, there's really good research that West Nile by itself develops a better immune response, and having vaccines that aren't so stacked up on top of each other. So I'm not a proponent of the 5-way that has like rhino, flu, EWT. Those vaccines, those hurt. I think those horses get extremely sore if nothing else.
right? Well, oddly enough, his neck was not at all sore, other than the
Oh
fact that,
gosh.
like, I couldn't even find the injection spot where it was.
Oh no. Poor
And
kid.
and I know what you mean about the people. I am myself unvaccinatable. I will get sick just like that too.
Yeah, absolutely. And that's the thing is we just kind of have to, you have to take each case into consideration, and they're they're a foreign material that we put in an animal's body, and we have to be prepared for things to happen, and we have to respond appropriately. So yeah.
So do you think maybe just try tetanus next time he's due for vaccines, and maybe just do that?
Yeah, exactly. And maybe talk to your veterinarian about doing some sort of pre-medication. I think that I would definitely do something in that scenario, is at least some sort of pre-medication, whether it be a low dose of dexamethasone or banamine or something like that, to kind of mediate things a little bit.
Thank
And
you.
would you
Absolutely.
give that Banamine, like, that morning, or
Yeah, there's in general, I like to have it at least in 30 minutes prior. And if it's going to be oral Banamine, you're probably going to want to be out there about an hour. Oftentimes, horses come to me, and like what I will do is I will run out there. Most of them I do know well enough to know that they're going to have an issue, so I'll go out there and give them, 5 cc's of dexamethasone or 5 cc's of Banamine, and then I'll go do something else and come back, and then vaccinate them and give them enough of a leeway. And I do the same things in dogs. I use Benadryl in dogs. So yeah,
okay,
yeah.
that's fabulous. Well, there's some great questions about vaccines, and there are some other questions too, so we might have to definitely have you back to answer those other questions. So I am going to go to Isabel's question. It's kind of a comment based on this exact topic, using the Banamine. Isabel, would you like to unmute yourself and ask your question?
Well, actually, Dr. Marsh did answer the question, because when all of my horses eventually started to have reactions to vaccinations. The least of it was fever, but at one point, my quarter horse had pretty severe swelling of his hind legs. And so, what we did is what Dr. Marsh just recommended, which is we unbundled everything.
Yeah.
Meant that we had to have the vet out more often, but to me, it was worth it because we still ended up with a little bit of fever with the horses, but between the Banamine and the dexamethasone, we stopped having the reactions. And so we just separated everything.
Yeah. I think that is a wonderful approach, because that's, you know, and I think ultimately you get the best immune response too. I think it is a immune response directly to a single vaccine, and split up. I do think that the more you let the body focus on one immune response at a time, I think that there would probably be some good interest in research to see how long, if those titers actually last longer than when you start comboing vaccines.
Hmm.
Yeah.
That's fabulous. Well, thank you for the comment, Isabel, and knowing that that works for your horses is fabulous. Brenda had a comment too. She said, "My vet gives core vaccines in the large rump muscles and instead of in the neck, so that there wouldn't be any swelling or possible breathing issues.
Yeah. Yeah, that's, and oftentimes if I do have a horse that gets sore, or especially young horses, I do give them in the big rump muscles. Also, they tend to, a horse rarely will stop walking, but they will stop moving their neck. And so the more that you can keep a horse moving, even if they get sore muscles from their vaccines, the better off they do. My big thing with vaccination is, especially if you have a horse that's sore, what I will get is I'll get sometimes colic cases that they gave vaccines 3 days before, and then the horse wasn't eating and drinking appropriately because they weren't moving their head up and
Oh,
down, to
wow.
drink and or to eat, and so it's a fairly common thing for me to see that happen. And so um, definitely post care after vaccines is important, making sure your horse is eating and drinking appropriately, and if they are sore, addressing that with something.
Well, that's really good to know. Something that I wouldn't have thought of right away, that they just the head movement
Yep.
can cause them soreness. So I have another question about age in horses. So I have a horse that's over the age of 20, several horses in our teens, and I think these horses have been exposed to everything, right?
Yep.
And at some point, I would think that vaccines would actually, their immune system obviously degenerates over time. Um, at some point, is it really beneficial to vaccinate these horses? And approximately what age or what health? Because I think it's just got to be a detriment at some point.
Yeah, I think you do have to start being kind of a little bit more conservative and careful, probably after the age of about 22. If I had to, if you kind of look at the research of when some of our older age diseases come about, our Cushing's disease and our um, uh, more profound insulin resistance, which those two things affect the immune system pretty profoundly. I think that you do have to be careful with those guys. I think that for me, I think I start breaking it down to mostly just core vaccines. The big thing is like, yeah, like you said, they're not going to have as good of an immune response, but at the same time, they might not have as good of titers. So it's kind of a catch 22. I think I definitely split up my vaccines a lot in my older patients. I do them a little bit farther apart, because I especially don't want those guys to get sore. But yeah, I think you have to be a little bit, you have to really kind of weigh which things that they have potential to get exposed to. And so probably focusing more on the mosquito borne illnesses is probably a little bit more appropriate in those guys.
Okay, thank you
Yeah.
very much. And we do have one more question. And if you do have a vaccination question, let's see, you have one more minute to put it up here. But there is one more question about exactly where in the hip do you vaccinate to prevent abscesses?
Oh, yeah. Um, Anytime I give vaccines in the hip, I do clean because obviously that is an area that can get contaminated with fecal material. And so, what you're looking for is that large muscle, that's called the semitendinosus muscle, which is going to be that large one that basically runs down, perpendicular or parallel to the axis of the leg. So, it is going to be the biggest muscle belly. You want to go below the level of basically the hip bones where you can push on your horse and you can feel bone. You kind of want to go below that, because above that, they tend to be actually a lot more sensitive. And I do acupuncture all the time, and if there's going to be a place I'm going to get kicked, it's going to be needles above that point of the hip, as you go up. So I actually sink it into the bigger muscles down lower, and plus they're going to move more in those big muscles. It's just a bigger belly, and the biggest thing on vaccine administration too is, when in doubt, if you have time, clean the area that you're going to poke them. And also, the other thing you want to do is you want to stick that needle all the way in. The biggest thing I will find is that some people get apprehensive if they're administering their own vaccines, and oftentimes only get it in just right under the surface. And it probably doesn't do nearly as much. There's not as good a vascularity there. You need to get it into the muscle in order to get that. The inside of the muscle also tends to be, especially when clean, probably the best place, the least likely to get foreign contamination from the outside and get abscesses.
Okay, thank
Yeah.
you. A fabulous answer to the question. And it looks like everyone was quite excited about being able to ask their vaccination questions. I know all of us out there are always, I'm sure you're in the same boat as me. We really don't want to over vaccinate, yet we don't want to be careless and end up with that problem. In your article, because you did go over, your core vaccines, and I'm trying to remember if you put a timeline in there in general, how I don't think you did.
I don't think I did put that.
But that timeline that you told us tonight, and I know that it's not the same for every brand of vaccine, but there is kind of a general idea where some are good for approximately 3 years, and of course, it's it's just such valuable information that it's really hard to find for some reason. So I
Yeah,
don't know
absolutely.
if you would be interested in writing another article specifically about antibody titers, which ones
Yeah.
we can test for. Oh, and then just I guess one more quick question: is that antibody titers? Is that something that I can go to you and get my horse tested for antibody titers, or is that only a specialized place?
No, it is something that I can get. Basically, I can draw the blood, and those things can be sent off to special, more than likely. So I looked, and basically, right now, the only titers that I could find on I use IDEX, which is a huge reference lab, but not necessarily do they always have every test. At IDEX, at this moment, what they have, the only test that they have available is titers for EHV1, which is rhinopneumonitis. And but a lot of the universities are starting to develop titers, and so oftentimes, like Cornell will have a test that the University of Tennessee won't, or I mean, so it's definitely one of those things that I think, because I've actually gotten quite a few more questions of late, even in the last like 6 months, I'm going to kind of try to dial in what vaccines we can actually titer for and what labs we can do that with. So yeah, I'd be absolutely happy to kind of get some of that information together for guys.
And do you think that that people don't titer as often as giving the vaccines because they figure, well, it's going to cost me? Does it cost approximately the same or the vaccine or more sometimes?
It's Unfortunately, it's quite a bit more expensive. I think that is probably some of the issue. Um, it's getting more and more economical in small animals, because I think I mean, obviously, there's just more dogs and cats in the United States. And so there is a little bit more of a push to have titers available for those guys. And so it is definitely less expensive. I think the EHV1 vaccine that I looked at, the titer for that was ranging almost in about the $100 range. So you can kind of maybe bank on it being about 3 to 4 times what the cost of your vaccine is, and which is kind of unfortunate, that it is that expensive, unfortunately. So
Oh yeah, that's really too bad, to be honest, because I think
yeah,
so many people would be so interested in doing the titers instead. So.
yeah, absolutely. So
Well, Dr. Marsh, I cannot thank you enough for coming and being with us tonight. I think that everyone really enjoyed this, and please let me know in the comments if you would be interested. I think they would love to probably have you back to speak about those topics that we didn't get to
yeah.
tonight, such as fecal testing and deworming, as well as founder and the immunosuppressed horses. So thank you
Wonderful.
so much, Dr. Marsh. We hope you enjoy the rest of your Nutcracker performance
Thank you.
this evening. And those of you who enjoyed it, please give us a thumbs up when we post this video on the IHA website. So good night, everyone.
Thank you.